Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining me remotely, we have Pradeep Goel. He's the CEO of Solve.Care. We're going to take a look at improving access to healthcare and patient-centric care based on the blockchain. Pradeep, it's great to have you with me. And I think this area of healthcare as it relates to technology is really exciting because it helps patients, it helps healthcare providers and administrators. What are some of the issues that the industry is looking to solve?
Thank you for having me, Jill. It's a pleasure. And the opportunity for a platform like ours is to really help with effective coordination of the patient, not just with the healthcare provider, but with other key stakeholders in their life, family members, employer, insurer. And the objective and the relevance of this is particularly evident in the scenario we're facing today, where the in-person care and the centralized care model just cannot sustain and cannot deliver in the current environment. So we've been working on this model for a while, and suddenly that model has been thrust into the forefront as we cope with the current crisis.
And what about the technology behind it? You're basing a lot of this on blockchain, right?
We are, and the blockchain really serves a very fundamental purpose of bifurcating the need for maintaining privacy and control over data and balancing that with the need to share enough information to effectively coordinate care. Healthcare is a team sport. Nobody gets well alone. Nobody gets treated as a single individual. And the ability to balance the competing needs of privacy and security and control and consent with the need for a timely and accurate and immediate notification of all the stakeholders of what's happening, that's the balancing act. And that's what blockchain is really good at.
All right, so let's take a look at our first slide here, and this is a demo of Care.Wallet. Tell us what we're looking at here and all the information that's available on the platform.
So the Care Wallet is a product that we designed which allows the consumer to maintain in their mobile phone a perpetual care ledger of everything that happens to them or the decisions they make. But the Care Wallet is actually an access portal to all the care networks behind the scenes that you have a need to and relevance to. So I can use my Care Wallet to join the care network sponsored by my employer and access my employee benefits. I can use the same wallet to join my insurance network and access my insurance benefits. And I could use the same wallet to join a diabetes care network to get information about how to manage my pre-diabetic condition. And that unique experience of what I need as a human being and drawn from different care networks becomes my personal care journey. And the wallet maintains that. And then you, with your wallet, would join a completely different set of networks, but your journey will look very different. But as we evolve through our life, through youth to adulthood to family to later in life, that journey remains in the wallet and in the control of the patient. So no matter where I am, which healthcare system, which insurance plan, which employer, which country, my Care Wallet and my care journey gives the next treating physician a true picture as to not just my medical data, but also how I have trended through life and how I have handled my self-care and my vital care protocols. So the objective here is, again, balancing the patient privacy and patient view of their care journey with the need to participate in external ecosystems like hospital or chronic disease management and bring them together in a way that you have full control.
Yeah, that's pretty amazing because not only does it make it more streamlined and efficient, but I would imagine with doctors having a true picture of what your health looks like, it only benefits the patient because you're going to get better acute care, the care that is designed specifically around your entire medical history. Let's move along to our next slide here. And this is some use case examples and how it would work on the platform.
Yeah, so there are three fundamental types of use cases. There is a use case around managing either disease or episode. So if you have an accident, if I have an accident and I need a 6-week recovery process from primary care to hospitalization to release to therapy, that's a full app care journey. Or I could have developed a chronic disease and I'm going to have a very long care journey of managing that disease progression and slowing that progression down, let's say diabetes. Or I could have a scenario where I'm dealing with managing the care of a loved one. So the use cases and the care model are how you organize the care team around an episode or around a disease. The second type of second type of use case here is around managing benefits. As long as I'm insured by this insurance company, I have access to their network and I can see the benefits, the eligibility, my deductible, my copay, my out-of-pocket maximum, my provider directory, and so on and so forth. But when I leave that insurer and I join another insurance plan, I can continue my journey, but now I have a completely different set of benefits. So that's the benefit management side of it. And the third side of the wallet is the ability to understand and see where my best options are to buy and what my payment options are to pay. So I can join voluntarily a network related to, say, discounted vitamins or related to certain type of medical equipment that I need, and then the ability to pay for them in the wallet. Those are the three pillars of care we're trying to manage: benefit administration, care coordination and disease management, and the financial management. And then you can create things called care circle in the wallet, which are your friends and family, people that you care for and people who care about you, who can participate in giving you emotional, financial, logistical support as you're working your way through this various stages of health. So the idea is to bring together and put the patient in the center of clinical care, but also in the context of, they are not just patients, they are human beings, they are parents, they are children, they are employees, they are insured, and to give this ecosystem the power to serve the patient, the power to access the full ecosystem. And then as their needs change, they change the network. That's the idea.
All right, Pradeep, thanks so much for joining us. We really appreciate the insight.
Thank you.
All right, and thanks for joining me on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.